Hello, this is Dr. David Greene, CEO of the Nevada Pain Network, where we bring you anything and everything educational for pain management. Today the topic is 5 things to know about failed back surgery. Well, first of all, what is it? It's when low back surgery fails due to one of multiple reasons. It could be that surgery was done and it was done for the wrong reason. Surgeon thought that the pain was going to be relieved by the surgery being done, but could have been that they thought the wrong level was causing the pain, or it could have been the SI joint causing the pain, and they did a fusion on the low back. So that's the first one. Second one could be that the surgery done was technically inadequate. Could be that the hardware wasn't placed properly, or the bones didn't fuse. Could be any one of those things. And the third one is that surgery was done for the right reason, and technically it was done well, but you just didn't get all the pain relieved. And that may be that you wanted 100% pain relief, but you may end up with 50% or 30%, and then in your mind that might be a failure. Another thing that can happen is the surgery can go well initially, but then you can get subsequent degeneration around the areas above or below, or scar tissue can form around nerve roots and cause chronic leg pain. So that's a little bit outside the definition of failed back surgery syndrome, but nevertheless it leads to chronic back or leg pain. So what are the symptoms? Well, one is obviously it's going to cause chronic back pain, and that may be just in the area of the low back. It may also radiate out into the flank. It may also go into the buttock area or the hips. It also can cause potentially leg pain. If you have some scar tissue around some nerve roots that were operated on, it can cause pain that's chronically going down the legs. You can have some depression because of the pain, inability to concentrate or work. So the first thing to know is the extent of the problem. Failed back surgery syndrome occurs in 20 to 40% of those who have back surgery. I have seen statistics as high as 50% after 2 years. Each time you have repeat surgery for the spine, you're going to have success rates that are lower than the one before. So the best chance of success is the first time, and every chance of success goes down after that. So 2 years out from back surgery, 1 in 4 patients is dissatisfied with their outcome, and like I said, I've seen that as high as 1 in 2. The second thing to know is that initial treatment for failed back surgery syndrome should consist of anti-inflammatories and Tylenol, over the counter. Those can help. Take those according to manufacturer's recommended dosing. Physical therapy and chiropractic treatment can help tremendously. This can also include TENS units, ultrasound, electrical stimulation, iontophoresis, things like that. And then oral or topical prescription pain medications. Is it a great answer to be on long-term pain medication? No. Are there indications for that when no more surgery is recommended or indicated? Yeah, it's definitely something to consider. So interventional treatment options, there are quite a few depending on exactly what the problem is being experienced. It could be some trigger point injections, which are superficially done. Those can help with spasms and what's called myofascial syndrome. Facet or medial branch blocks can be very helpful for relieving pain above or below with arthritic joints. Maybe an injection around the hardware can help to see, if that is causing some of the issue. It's infrequently that it would be, but it can be tried. There's very low risk in that. Epidural injections can be extremely helpful. You can see those, one being done right here. And that could be, if there's pinching or spinal stenosis above or below where the nerve roots are being pinched, that can help dramatically. It may be that the decompression that was done in the initial surgery was not adequate enough, and the pain doesn't get totally relieved, and that can be diagnostic and also therapeutic. Radiofrequency ablation is a procedure that heats up the nerve endings that are around these arthritic joints, and that can help relieve pain for 12 to 18 months. It can be very helpful. And if all else fails, a spinal cord stimulator, which looks like this, you have a battery and then cables leads going into the area around the spinal cord, can be very helpful. It's been revolutionary. It's excellent for both back pain and leg pain that does not have a surgical answer. It doesn't cure the problem, but it can change the way that the brain perceives pain signals and give extensive relief. It works well over 75% of the time. You have to get a trial placement first for about 5 to 7 days, and then also a psychological evaluation to make sure you can have the final. So the fifth thing to know is that success is achievable with failed back surgery syndrome. It's not usually possible to achieve 100% pain relief, but if you can get a dramatic amount of the pain gone, then you can be much more functional, get back to work, play with the kids and the pets. It may be that you need multi types of options as far as spinal decompression therapy, epidural injections, facets, physical therapy, things like that. The top pain management clinics in Nevada offer all of these options. The Nevada Pain Network works with the top pain clinics in Nevada. They have board-certified and award-winning pain doctors, chiropractors, physical rehab, and acupuncture, multiple locations throughout the area, Las Vegas, Henderson, Summerlin, accepting over 50 insurance plans, including PI, work comp, PPOs, some HMOs, Medicare and Medicaid, and self-pay. So one-number scheduling, call 702-323-0553 and visit us on the web at nevadapainnetwork.com. I'm Dr. David Greene, CEO of the nevadapainnetwork.com. Your pain stops here.